Namaskar everyone, my name is Dr. Manish Yadav and I'm back here again with a wonderful sharing of experience. In last few months, I've been studying something very crucial, very important. This subject which I'm going to talk to you, or maybe rather what I'm going to share with you, is actually the experience that I've gone through in last few months. Ideally, I've been using this method for a long time in my practice. Boger's approach. What is Boger's approach? Is it really relevant in our clinical practice? Come, let's try and understand. So Boger's approach. Uh, so if I give you my example, the way practice I do and the kind of cases I see, I deal a lot of acute and pathological cases have to be deal in my practice. So Boenninghausen repertory, PBCR, Boger Boenninghausen repertory. This repertory has been a most important tool in my clinical practice, along with Kent repertory and other repertories. But BVCR has been a very important tool in my clinical practice, and it has helped me in some of my very challenging cases, especially acutes or some really cases where I'm stuck or less data is there and I'm not able to get the complete idea of the remedy. It has really helped me. So I've been always fascinated with Boger Boenninghausen repertory. But when we talk about Boger, now Boger Boenninghausen repertory was compiled by Boger himself. But when we talk about Boger, especially Boger Synoptic Key, now this is one book which I have read it a few times. I tried to understand it many a times. But as I was getting a lot of results with my BBCR and of course, the approach I had understood, this very wonderful book called Bhanu Desai. I had used Bhanu Desai a lot to get the practical knowledge of how to use BBCR. So I have been very contented with my practice. But as you mature, as you go more in your practice slowly and steadily, there are times when you feel some vacancy, like somewhere you feel something is missing, and you always need to advance and learn. So a few years before, I was passionate about Burnett. I wanted to learn everything about Burnett. So I worked on it, and I've made a lot of videos of Burnett also. You can learn from there. Now, Boger's approach. Why Boger's approach? Because I have realized that whatever Boger has taught, BBCR, like BBCR I've been using, the philosophy that I've been using, it is very interesting. And that is the reason why maybe I've used it in some of my practice, some of my cases. I got really stimulated and motivated to learn more about. So when you want to learn any subject, what do you do? Like what I do is that I always search some people who have done mastery over it, who have written some really good books, or maybe books from literatures from past. So I will share you the books that I have been reading because my purpose here is to show you a way how I am studying, and there are resources and guide you. My purpose is also to guide you to those resources. So let us see. I have also been following some people on YouTube. There are some really good lectures that I got, some really good content which I got, and I've been following them, using them, and trying to learn and evolve myself as a student. So in my this entire talk, I'll be talking about some other people also whom you can follow, you can learn, because our idea as a homeopathic community is to share and spread our knowledge, and whoever is doing the best thing, we have to learn from it and again spread it to others. So this, my community, my students and my colleagues, this entire podcast, this entire YouTube or podcast which I am making is especially to give you my understanding, share my learning, and also to guide you to the resources, to the sources from where I'm getting my knowledge, so that you can also go study and make your own understanding out of it. So let's start. Let me share my PPT, and from there we go. Okay. So this Boger Synoptic Key. When you talk about Boger Synoptic Key, this is the book. Of course, we should always buy this small book. Like Alan's keynote also, we should buy the small one, not the red one. Same as this Boger Synoptic Key. So first we'll talk about the introduction. As I told you that I have been studying and I've been looking for resources, and I've got a lot of help a lot of nuggets from a YouTube channel, which I'll be sharing the link also in my description. But I'm giving you the name of this professor. His name is Dr. Rashid Akhtar. He's a homeopath with extensive experience practicing in Greater Noida. And he puts Homeopathic Academy. The channel's name is He Puts. Puns. And maybe I'm not pronouncing it right. He's an renowned professor, and I have loved his lectures, and I have learned many things from his different lectures also. Like he has given a wonderful talk about miasms, which is one of my favorite topics. I've made a lot of notes out of his lecture. I do not know him, neither he knows me, but that is the beauty of social media, that if you are really good, your knowledge can go, and you should share it, whatever is good. The right people will connect and they will make help use of it. So thank you, Dr. Rashid, for your wonderful YouTube channel, and so many people are benefiting. So rather you watch my this lecture or not, because in this beginning of my talk, I've taken a lot of excerpts from his talk. So originally, I would urge to my colleagues, you should go and watch his Boger Synoptic Key talk. There are two videos, part one and part two. And you will get amazing nuggets. I'm not going to share anything from that, okay? But I'm just going to share some key pointers which I learned, which was like, stimulating to me. But he has definitely given a lot of different ideas about how to study Boger. It's not just about giving an essence like Boger has this, because I've watched many of the YouTube videos on Boger and I was completely dissatisfied. Everybody's talking about the structure and this and that, but real essence, how to use this, how to master it, you can get all the descriptions in Dr. Rashid Akhtar's lecture. So I would urge to my colleagues, my students, even you can stop my video right here and you go and watch it 2, 3 days, 4 days, you make notes, watch it half, whatever the way you want, but apply, and not just watch it. You have to watch it, and then whatever he's saying, he's talked about making diaries and a lot of things, practical aspect, do it in your practice. You will be very thankful to me, of course, but not me, but to Dr. Rashid. So let's go ahead and let's share some pointers towards it. So Synoptic Key. Now, this book, when you look at this book, Synoptic Key, the name is Synoptic Key to Materia Medica. So basically, this book, initially I used to think that this can be used as a repertory, because there's a repertory also, and Boger Synoptic repertory also we have got. But actually, ideally, this book is for Materia Medica. Hence it is written Synoptic Key to Materia Medica. What is the meaning of synoptic? Synoptic is derived from the word synopsis. Summary. Basically, it's summary. Means complete summarization of any bigger work. So what Boger has done, Boger has summarized a remedy. Like suppose you talk about Thuja, Aconite, any remedy you talk about, there are big descriptions, like Kent, big descriptions. Some book clinical description, Clark, big descriptions. What Boger does is, in short, he makes this concise, and for quick reference, he summarizes the entire drug. I had heard this many of my some lectures. I had heard that one paragraph of Kent equals to one line of Allen's. One line of Allen's equals to one word of Boger. So Boger is very tough. Let's not study that. But if that one word, just imagine the genius of the person. If he's able to describe the entire remedy in few words, don't you think he's a master? And that understanding, if we can develop, don't you think we can really help our patients and have better understanding in our drugs? Definitely. So that is the meaning of synoptic. The key pointer, as I said, it is enter into Materia Medica. So I have always been speaking this, that the ardent student of homeopathic practice has to be student of Materia Medica. Other things are there, important. Repertory is important. Philosophies are important. So philosophy and Materia Medica. But as you go into practice, your Materia Medica knowledge has to be more and more. So we have to dive into learning Materia Medica. Our more energy has to be in studying Materia Medica. More you study Materia Medica properly, better clinician you become. So center point is study of Materia Medica. Let's focus on that. So is Boger. Actually, Boger, if you, I'm just trying to give you a little glimpse of it and little background so that from there we go ahead. Boger was actually a bridge between two stalwarts, Kent and Boenninghausen. So what did, see, we have got two very big stalwarts. One is James Tyler Kent and Boenninghausen. But when you look at the philosophies, they look like rivals. They are, ready to fight and contrary, both talk contrary to each other. Kent, Boger was actually student of Kent. So he learned everything about Kent and he's a master, we all know. But he was also fascinated by Boenninghausen's approach and understanding. So he was the person who actually bridged. He got the Boenninghausen's concepts and took the help of Kent, structure of repertory and everything, and he amalgamated. And that's how Boger Boenninghausen repertory came into place. And so much useful it is, so much useful. So he was student of Kent but loved Boenninghausen's work. Now, what is the difference between Kent and Boenninghausen? Let's first understand that. So you must be knowing in your college. Kent was talking about deductive logic and Boenninghausen talked about inductive logic. What does that mean? In Boenninghausen, when we study Boenninghausen concept of analogy. What is analogy? Concept of analogy is comparison of two. You compare and differentiate from there. Basically going for particulars to generals. So he will focus on particular symptom and what is true to the particular, he said true to the whole. So he would go from particular to general. What did Kent said? Kent said focus on will, emotion, intellect. And his Kent main philosophy is man is not in his organ. Man is not in his organ tissues. He is in his wills and emotions. So whole part of man. Kent always focused on whole part of man than to focus on particular tissue level, organ level. Boenninghausen said, no, don't worry about that. Focus on tissue level. So this was a great contradictory, poles apart things. So going from generals to particular is Kent, and going from particulars to generals is Boenninghausen. The only problem with Boenninghausen was that he not only generalized everything, he overgeneralized. So this was one of the very big criticism actually, because like suppose somebody is having burning in the knee, he would say the burning is everywhere in the body. So sometimes it is true also, but many part, some people have got burning in the knee, some people have got maybe coldness in the head, the same patient. It can happen, but he would overgeneralize it. And this point, overgeneralization, was something which was against Boenninghausen's approach, according to Kent. Whole to the part reverse of Boenninghausen parts to whole. Okay, we understood that. So that was okay. Everybody knows about it. For me, the most important thing which I learned from Dr. Rashid was about general analysis repertoire. As we know, Boger, we are talking about Boger. So Boger has made this Boger Synoptic Key. But there's one more book, one more repertoire that he has. It's called Generalized Repertoire. So if you open the chapter here, generalities, in Boger Synoptic Key repertoire part, generalities, there are a lot of general rubrics. Now we know that Boger followed Boenninghausen's approach. So he promoted generalization, general rubrics. So generalities chapter is very important, very important. So general repertoire is somewhat similar to that. Many of the things you'll find it here and there, almost similar. So there's a general repertoire, general analysis. And the foreword is written by Dowley. Okay. I would urge that you can get the PDF of general repertoire, general analysis repertoire from online. You can get it and read the preface of it, the foreword basically. Something interesting was about mental symptoms written by Boger. So it's a great work of Boger is Boger General Analysis, General Repertoire. the generalities chapter. So when you read, now we'll analyze this. When you read Boger General Analysis intro, few excerpts I'm getting it. This was something very interesting. And of course, I believe in this, what he talked. That's why it made a lot of sense. These were the points which Dr. Rashid mentioned in his talks. And I have just taken it from him directly because I really love these talks. And exactly, I'm quoting it here. So as I told you, again, I'm telling, go back and listen to Dr. Rashid. He's the real source for this. And I'm really thankful to him. But to my colleagues and my students, as I learned it from him, I want to spread it out. When you go in intro, this is what is written. So it really appealed to me what he talked. He said, it is written there, any of these mental conditions in the patients will have to be determined by alert, accurate physician having sound knowledge of logic and psychology. Any of these mental condition means there is something else also written before that. All the mental conditions that you take, we have been taught the methodologies that we take, we use it. We are always, everybody, like in homeopathic practice, when I see left and right, everybody is talking about mental symptoms, analysis, going deep into mind, and how faulty it could be. Because I have done it for years and I've failed miserably. Miserably, I have failed. What he writes about it, mental conditions, for examining the mental conditions, the physician has to be very accurate. That's okay, but physician should have sound knowledge of logic and psychology. So, my dear homeopaths, ask yourself how many books, how many literatures of psychology have we read? How many logics books have we read, or practically we have seen it? What does that mean? Is the meaning is skill is needed to analyze mind symptoms. Patient comes and shares a story, and we just interpret and make some delusion out of it. We make some fears out of it. We analyze and we make the dreams, dreams of this. Maybe it means this. This is all wrong. What do you need to analyze mind symptom is a skill is needed. Basic understanding of human nature has to be there. Patient comes, sits, he's laughing, he's talking, he's shying away his eyes, he's looking into your eyes. These are subtleties. How do you know? I always ask this question to myself also and others also, that in anacardium it is written, like suppose in balance keynote, anacardium it is written that he's very vindictive, malicious, and vindictive, difficult to bend, wickedness. These some very bad qualities are written about anacardium. Now tell me, how do you know when he comes and sits in front of you? How do you know that he's really wicked, he's jealous, or any remedy which is jealous, all the negative things, desire to murder, so difficult it is. So to enter into human mind, you need to understand human nature. You have to face, for that, you have to face man directly, not just books. People think that I will read books, I will attend sessions, seminars, and I will learn. No, you have to be in crowd, in public. Human psychology can be understood by being present in the surrounding of the people, dealing with people, knowing with different people, different cultures, communities. When you deal with them with open mind, that's how you learn. More the interaction with human you need to have. You need to have more interaction. Now, when a homeopath gets out, or like I'll give you my example. I studied in my college. I was in my college, did whatever a student does, everything. Then I came and started working with my seniors. Then I started my practice. Where was human interactions? Only patient interaction was there. I'm talking about myself. What about others? So when a homeopath gets out of college, few years he puts in studies, and he's thinking that now I have read these books, I've attended these lectures, now I know this rubric, this and that. I will start practicing. And you directly jumped into mind. Patient comes and sits, and you just want to understand the mind. The concept of this mind symptom is so much ingrained in our body, in our psyche by our so-called legends, that we are always looking for mental symptoms to corroborate. Until it matches, we don't want to give the remedy. Now you read this, what Boger has written, how faulty and how misleading it can be. For that, we need the skill, and this skill can be obtained by being in human. You need to have Your study of books will be useful to you only when you do these things. It requires field work. So a lot of field work is required. So this entire skill that we talk about, that he talks about learning the type psychology and logic, sound knowledge you need to have to understand the mental symptoms. It is a skill which you will get as slowly your practice builds up. So how faulty it could be to just try to understand mental symptoms. And there are so many systems right now, there's one system which patient comes and sits and he says some words, and from words you are interpreting so many things. There's one rubric, and that one rubric has got so many different interpretations. You practice whatever you want to practice, but according to me, it is very risky, very risky. Boger says in that general analysis, because the mental state, the conscious and subconscious, revealed by general behavior, the conversation, the expression of countenance, the desire and aversions, the manner of sleeping, as well as by the voluntary verbal expression. What does that mean? It means mental symptoms spoken through words are less reliable than spoken through eyes, facial expression, behavior, and emotions. So the mental symptoms comes from conscious and subconscious mind. Generally, the behavior of the patient means the what patient talks. Now, this is so contradictory to the practice, because what the way I have been taught, which I was doing earlier, and what I see other people teaching is that focus on what patient is saying. So there is a system where they talk only about what patient is talking. Pick up the words, pick up the words. The words are important. What Boger is saying. What words say is not that important, but look at the eyes, the facial expressions, the behaviors, the emotions. Those are the things which are more important than what actually patient speaks. Horizon number 208. So you can read this. I will just go to the meaning of it directly. It means that not all mental symptoms are symptoms of prescribing. Okay, I should read that. The age of patient, his mode of living, the diet, his occupation, his domestic position, his social relationship, and so forth, must next be taken into consideration in order to ascertain whether these things have tended to increase his malady, or in how far they may favor or hinder the treatment. In like manner, the state of disposition and the mind must be attended to learn that whether that presents any obstacle to the treatment or requires to be directly encouraged or modified. The entire scenario means what? I will explain it very nicely. This means that not all mental symptoms are symptoms for prescribing. Now, this is so interesting. Whatever patient comes with any mental disturbance, we always want to address it. My friends, we also get so many times depressed, confused, melancholic, angry, irritable. Not everything has to be found out a remedy. We don't need to find a remedy for everything. You have to judge whether the mental symptom that you are analyzing is a part of his personality or it has been due to his surrounding, his situation. So if it is because of the situation, if it is because of, the surroundings, maybe counseling, maybe talking to him will help him. You don't need to analyze it. So is it from his personality? Is it coming from his personality? Again, the question comes of common symptom and uncommon symptom. So when we enter into mental symptoms and when patient is talking, you should always think whether I should take this symptom. Is it really a symptom or not? If it is coming from sudden change in surrounding. Now, suppose somebody gets laid off of a job, somebody has a heartbreak, somebody has some situation death in the family. Those emotions are going to be very common. Think about it. Does it actually need any treatment, or he will just pass on? How many times we prescribe on just whatever patient is saying? If it is so, then there is a correction for that, but it is no importance for prescribing. Of course, you have to address those things. If he's disturbed, he's affected. But for prescribing a remedy, it is not needed. It is not needed. This is not denouncing the importance of mental symptom, but taking a lot of care and not to be adulterated. So when we are talking about this, of course, we're not saying that mental symptoms are wrong and you should not take it. In fact, prescribing on mental symptoms is one of the best things because once you get a good mental symptom, your prescription is amazingly, it works. Definitely. But the problem is you should have the right mental symptoms. Many a times we are just prescribing on the symptoms which are not important, for prescribing. So that is why he cautions us. What he does, he cautions us. Precautious. Be very precautious. That's what he's saying. Don't be loose enough and directly jump to the mental symptoms. That was the ideology behind that. So in general analysis, Boger understood that what Kent is saying is right. So this is very interesting. He said, what Kent is saying, as he was a student, right? He said, what Kent is saying is right. Sorry, I missed it. Yeah. So Boger understood what Kent is saying is right. As he was a student, he learned under Kent, but he also understood how difficult it is to judge the mental symptoms and what kinds of skills are required to follow Kent. So he is not saying that Kent was wrong. No. See, I've also been practicing so many years. I can just show you cases on Kent's repertoire, Kent's philosophy. Wonderful case. But I can also show you cases where I have failed also. And I've used Boenninghausen and succeeded. So Kent is not wrong, but he's saying that to judge a mental symptom, there's a different kind of skill is required. So we should focus on learning that kind of skill more than to practice. So it is not easy to practice on mental symptoms. That's what he's saying. He was also much fascinated by Boenninghausen and he believed in him too. So he thought, what could be the midway? So what is the midway between these two? And then came the concept of general analysis. That is a book, that is a repertoire, that is a part you should get in your hand. Boger general analysis contains those symptoms which are summarized and it belongs to both mind and the body. Mind reflects through physical body and also general tendencies reflects through the body. So it is vice versa. Mind will reflect whenever mind is disturbed. It will reflect to physical body and the general tendencies to your body. So body is very important. You can't just miss what body is speaking. We have to understand what body is speaking. Boger says, go to mind through physical body and physical expression. That is what Boger said. He said, to be sure, if you go to mind through physical body, physical expression, the chances of failure and diverting and getting misled is less. Or you do reverse, then there are high chances that you can fall in the pit. But if you go to the mind through physical body and physical expression, that can be of great. So that was a short introduction about Boger, basically the general analysis. And I'm going to stop my lecture here because I want to make it a part of it. In the next session, part 2. It's part 1, part 2. I'm going to come up with Boger's methodology. And this is so interesting. I have loved so much. As I talked to you about Dr. Rashid Akhtar's video, I've got some other sources also from where I'm learning. And I'm going to share with you Boger's methodology. How easily and how nicely, sorry, he has simplified. And once you understand that, your way of practice will be very much easier. So let's meet for the next part. Thank you very much.